Welcome to this Guru Kat's podcast about youth mental health, addressing the needs of the next generation. Mental health is a critical component of overall well-being, encompassing emotional, psychological, and social aspects that influence how young individuals think, feel, and act. It is the foundation for a healthy transition from childhood to adulthood, impacting academic performance, relationships, and future opportunities. The importance of addressing mental health issues among youth cannot be overstated, as adolescence and early adulthood are pivotal periods for mental health development. Alarmingly, statistics reveal that 1 in 5 young people experience a mental health disorder, with many cases going undiagnosed and untreated. Factors such as academic pressure, social media influence, and family dynamics contribute to the complex landscape of youth mental health. By understanding and addressing these challenges, we can create supportive environments that promote resilience, reduce stigma, and provide necessary resources. This podcast delves into the multifaceted world of youth mental health, exploring strategies to support and empower the next generation. Understanding the landscape of youth mental health requires a comprehensive view of its historical context, current trends, and the evolving challenges faced by young people. Historically, youth mental health was often overlooked, with societal norms stigmatizing mental health issues and limiting open discussion. However, recent decades have seen a growing recognition of the importance of mental health, spurred by increased awareness and advocacy. Today, mental health disorders such as anxiety, depression, and ADHD are prevalent among youth, affecting millions worldwide. Social media and technology, while offering new forms of connection, also contribute to heightened stress, cyberbullying, and a constant comparison culture. These platforms can exacerbate feelings of inadequacy and isolation. Current statistics paint a stark picture: suicide rates among young people are rising, and many suffer in silence due to stigma and lack of access to care. Understanding these trends is crucial for developing effective interventions. By acknowledging the historical context and recognizing current challenges, we can better address the mental health needs of the next generation. Identifying the challenges in youth mental health involves examining both internal and external factors that impact young people's well-being. Internally, biological and psychological factors play a significant role. Genetic predispositions, brain development, and hormonal changes during adolescence can contribute to mental health issues such as anxiety, depression, and bipolar disorder. Psychologically, young people are navigating identity formation, self-esteem, and the pressures of academic and social success, all of which can lead to significant stress and mental health challenges. Externally, social, cultural, and environmental influences are profound. The rise of social media has created a pervasive culture of comparison and cyberbullying, affecting self-worth and increasing anxiety. Cultural factors, such as societal expectations and norms, can also pressure youth, particularly those from marginalized communities. Furthermore, environmental stressors like family instability, economic hardships, and exposure to violence or trauma can exacerbate mental health issues. One of the most significant barriers to addressing youth mental health is stigma. Many young people fear judgment and ostracism if they disclose their struggles, preventing them from seeking help. Additionally, barriers to access, such as lack of resources, insufficient mental health services, and socio-economic constraints, further hinder young people from receiving the support they need. By understanding these multifaceted challenges, we can develop more targeted and effective interventions to support youth mental health. Schools and communities play a pivotal role in supporting youth mental health. Educational institutions are uniquely positioned to influence young people's well-being positively. Integrating mental health education into school curriculums can raise awareness and reduce stigma, equipping students with the knowledge to recognize and address mental health issues. Programs such as mindfulness training, stress management workshops, and peer support groups can foster a supportive school environment. Teachers, often on the front lines, need training to identify early signs of mental health issues and to provide appropriate support or referrals. Beyond schools, communities offer a broader network of support. Community organizations, youth clubs, and religious groups can provide safe spaces where young people feel heard and valued. These organizations can run outreach programs, workshops, and support groups, addressing mental health from a grassroots level. Parental and familial support is crucial. Parents should be educated on the importance of mental health and how to create a nurturing home environment. Engaging families in discussions about mental health can break down barriers and encourage open communication. Collaboration between schools, community organizations, and families creates a robust support system. Local mental health services and professionals can work closely with these groups to offer accessible resources and interventions. Community-wide initiatives, such as mental health awareness campaigns and wellness fairs, can promote a culture of acceptance and support. By leveraging the strengths of educational institutions and community networks, we can create an environment that prioritizes and protects the mental health of our youth. Implementing effective strategies to improve youth mental health requires a multifaceted approach. Here are 10 key strategies. 1. Increase awareness and education. Incorporating mental health education into school curriculums helps normalize discussions around mental health, reducing stigma and increasing understanding. 2. Reduce stigma. Public campaigns and initiatives that promote open conversations about mental health can help break down the barriers that prevent young people from seeking help. 3. Improve access to mental health services. Expanding the availability of mental health services in schools and communities ensures that young people can receive timely support. This includes telehealth options, which can reach those in remote or underserved areas. 4. Train educators and parents. Providing training for teachers and parents on recognizing and addressing mental health issues equips them with the tools to offer early intervention and support. 5. Encourage healthy lifestyle choices. Promoting physical activity, nutritious eating, and adequate sleep are essential components of mental health. Schools and communities can support these behaviors through various programs and policies. 6. Foster safe and supportive environments. Creating safe spaces in schools and communities where young people can express themselves without fear of judgment is crucial for their mental well-being. 7. Utilize technology responsibly. Educating youth on the responsible use of social media and technology helps mitigate its negative impacts on mental health. Encouraging digital detoxes and setting healthy boundaries can reduce stress and anxiety. 8. Peer support programs. Establishing peer support groups and mentoring programs allows young people to connect with others who understand their experiences, providing a sense of belonging and validation. 9. Early intervention and prevention. Implementing early screening and intervention programs can identify mental health issues before they escalate. Schools can conduct regular mental health check-ins and provide resources for those in need. 10. Policy and advocacy. Advocating for policies that support youth mental health at local, state, and national levels ensures sustained funding and resources for mental health programs. Engaging in policy discussions and supporting legislation that promotes mental health is crucial. By adopting these strategies, we can create a supportive ecosystem that prioritizes the mental health of young people, fostering resilience and empowering them to lead healthy, fulfilling lives. Looking towards the future, innovative approaches and continued advocacy are essential for advancing youth mental health. Emerging trends in mental health care, such as digital mental health tools, offer new avenues for support. Apps that provide mindfulness exercises, mood tracking, and virtual therapy sessions make mental health resources more accessible. These tools can complement traditional therapy, providing continuous support and immediate help in times of need. Successful programs and initiatives around the world offer valuable insights. For example, school-based mental health programs in countries like Finland and Australia have shown significant positive impacts, integrating mental health into everyday school activities. These models highlight the importance of a holistic approach, combining education, community involvement, and professional support. A call to action for individuals and communities is crucial. Everyone can play a role in supporting youth mental health, whether by advocating for better mental health policies, volunteering with local organizations, or simply being a supportive presence in the lives of young people. Small actions, such as initiating open conversations about mental health or participating in community wellness activities, contribute to a larger culture of support and understanding. As we conclude this discussion, it's vital to remember the importance of continued dialogue and action. The mental health of the next generation depends on our collective efforts to create environments that nurture and support their well-being. By implementing effective strategies, leveraging innovative tools, and fostering a community of care, we can make a significant difference. The journey to better youth mental health is ongoing, and with sustained commitment, we can build a future where every young person has the opportunity to thrive. In conclusion, addressing youth mental health is imperative for nurturing a healthy, resilient next generation. The journey begins with understanding the complex landscape of youth mental health, recognizing both historical contexts and current trends. Identifying the multifaceted challenges, ranging from biological and psychological factors to social and environmental influences, is crucial for effective intervention. Schools and communities play a pivotal role, providing essential support systems through education, safe environments, and accessible resources. By implementing strategies such as increasing awareness, reducing stigma, and improving access to mental health services, we can create a robust framework that supports young people at every stage of their development. Looking forward, embracing innovative approaches and continued advocacy will be key. Digital tools and successful global programs provide blueprints for future initiatives. The collective effort of educators, parents, policymakers, and community members can transform the mental health landscape, offering young people the support they need to thrive. Our call to action is clear: continue the conversation, advocate for comprehensive policies, and create environments where mental health is prioritized. Through sustained commitment and collaborative efforts, we can ensure that the mental well-being of young people is safeguarded, paving the way for a brighter, healthier future.